Hello viewers, this is Health Now Show, your health friend. With me, Jane Kariuki, and I am a counseling psychologist. For those that have not been with us, on this show, I want to take this opportunity to welcome you and to tell you you're in the right place. Today, we are going to have a very exciting topic, and this topic is a topic that sometimes is misunderstood. And in our communities, we have this topic that I'm going to share with you that is epilepsy, and more so in children. What are some of the things that people talk about when a child has epilepsy? And even to start us off, as we go along on this episode, I would like you to go to our Health Now Show YouTube channel, and at the comment section, write us a comment and tell us, how do people define the cause of epilepsy in your community, in your town, in your village? What do they say about it? If a child has epilepsy, what do they say? Leave a comment there. Also on our Facebook page, Health Now Show, and we'll be glad to hear more even as we go along. And thank you so much, and you're welcome, all of you. To take us through this today is Dr. Maureen Njoroge, and she is a pediatrician neurologist. She's going to unpack all this, and she's going to look more closely into the issue of epilepsy in children. And without further ado, I will allow her to introduce herself further and take us through this very important topic. Karibu daktari.
Thank you so much, Jane.
Yes.
So yes, my name is Dr. Maureen Njoroge.
Yes.
I'm a pediatrician and a neurologist.
Yes.
And I work in Kiambu County. So you can find me at Kiambu Doctors Plaza.
Yes.
And our contacts will be at the bottom of the screen.
Okay.
And I'm very excited to be on this show.
Yeah. Karibu sana.
Asante sana.
I'm also very excited to host you.
Thank you.
Very, very, because this is an area that most of us may not be aware of, the issues that are there. And especially talking about children. We've been talking about adults, we've been talking about, different segments of the community, but children, we haven't talked so far. So I'm so happy to have you.
Thank you.
Okay, so kindly define to us, what is epilepsy in children?
Right. So epilepsy is a condition that is characterized by things that we call epileptic seizures.
Okay.
Yes. So it is an epileptic seizure is when you have the brain cells that are firing at the same time or excessively.
Okay.
Yes. So for a child who has epileptic seizures that are unprovoked, and what we mean by unprovoked is they are not secondary to fever or other things that are leading to get the epileptic seizure, then we say that you have epilepsy. So if you have one seizure that is unprovoked, epileptic seizure, or you have an epileptic seizure and you have something we call an epilepsy syndrome, then we say that you have epilepsy. But in other words, it's what people usually say kifafa.
Okay.
Yes.
Yeah. And I guess in different communities, they have different words.
Yes.
For kifafa. For the epilepsy.
True.
Yeah.
In my community, we say kungangadara.
Kungangadara?
Yes.
Okay.
So that's another term that is commonly used. Yes.
Yeah, probably kind of a descriptive way.
Yes.
Kungangadara, like the way somebody is.
Yes.
The way the child presents. Okay. Tuendelee.
Right. So I think epileptic seizures can be very different. So I think what everybody thinks about when they think about an epileptic seizure, they think about this child who is moving the arms, and then the eyes are going upwards, and then they're removing the saliva and everything.
Yeah.
But there are so very many different types of seizures, some of which people may not be aware of.
Okay.
So you can have a child who is just tearing. just looking at one place, you're trying to get the attention of the child, but the child is not looking at you.
Yeah.
That's a different seizure type. You can have just a jerk where the hand just moves by itself. And this child is probably called clumsy by the parents. Huyu anapenda kuvunja vitu kwa nyumba. But actually this child is having seizures every single morning. So the seizure types are so different. So I think it's an important topic because when everybody thinks about epilepsy, they just think about the jerking.
Yes. Actually, that's most of us. I guess I'm speaking to some people, so some of our viewers looking at us. Yeah, to delay.
Yes. So in terms of the different seizure types, the most important thing is when you're coming for a consultation and you feel that your child, there's something wrong, you don't know what it is, there's some movement that you're not understanding, then the best thing would be to take a video of the child. So if you come with a video in a consultation, then we look at the video, then I'll be able to tell you, all right, so this is this type of movement. It helps with characterizing the seizure type. It helps us to know whether, which test we are going to, are we thinking epilepsy or not. So that's the best way. So I think for any movement, whether it's a staring episode where the child is just looking at one place and is not responsive, whether the child is just having these jerks in the morning, whether it's one-sided movement, I think the best thing would be to just take a video, then bring it to the consultation, then we can review it and find out what exactly is the issue.
Okay.
Yes.
I'm hearing you talk more of morning.
Yes.
Does it mean that most of these seizures come in the morning?
Yes. So there are particular types of seizures that come in the morning, and then there are those ones that usually happen at night. So there are different types of seizures. So the ones that you typically see in the morning are the ones where the hand is just jerking. And they're the ones now, you'll find a mother coming to tell you, my child just keeps making, pouring tea everywhere. And it's a child who wasn't doing that before. So they're wondering, okay, this one has just become clumsy, what is going on? But so that's a particular seizure type that's usually in the morning. There are some seizure types that usually occur at night, those ones from the frontal part of the brain. There are some that occur during the day. So you can have seizures at any time, but then just to put it again, there are very, very many types of seizures. You can have now like the staring episodes where maybe a teacher has come and told the mother, your child just keeps anazuba. Mtoto wako anazuba. It doesn't look like anaelewa what is happening in school. Then you notice that maybe the grades are coming backwards and things like that. So when you hear this from the teacher or you hear this from the mother, then you think about particular seizure that can actually cause that. And I think it's important to know because sometimes we label children as just being naughty or they're not, they're just, being not cooperating in school, but it's not out of their own volition. It's due to something that's happening in their brains. Yes. And I think that is the misconception that may be there, and then it may delay even intervention or even going to see to seek health care. True.
So because it is misunderstood.
Yes.
And I think that is why that you are here, so that we can really get this one out there, so that people understand and seek help as early as I think it should be.
Yes.
Okay, tuendelee.
Right. So as you've said about the misconceptions, yes, there's this thought about epilepsy being, such a debilitating disease. Yes, it can. It is because at the time where usually seizures are not very, or convulsions, what people call convulsions, they're not very innocent. It's like they come with their sisters and their brothers. So if you're having a convulsion, what happens is for some children they go backwards. So in terms of their schoolwork, they can go backwards if it's untreated. So if in terms of they can become hyperactive because they're having these constant seizures. So they can lose sleep. They can have mood disorders. So a child could be convulsing and then just becomes angry, aggressive. So all these things could be just because these seizures are untreated. So I think it is very important for people to know that, you have to treat the seizures because they're not innocent. If they stay for long, or if you have a prolonged seizure or convulsion, so the one where you're jerking, you can die. So, and in any case, one of the common causes of death in epilepsy is something called sudden unprovoked, SUDEP. So where you have a seizure and it's a sudden unexpected death secondary to epilepsy. So you have a convulsion and then you just pass on. So I think the thing to know is that if a child has epilepsy, it is best that they are treated. So of course that's the worst case scenario. But the other things is that the child will be, not probably do as well as they could in school. They'll have mood disorders. They're not getting along with people or their parents. So I think it's important we catch them early.
We catch them early. Yeah. So we've now looked at the definition and the types of seizure and types of. I don't know. I'm not. I'm not. A specialist in this, but the definition part. You've classified them again, like in types. In types of those.
Yes.
So what are some of the? I know you've mentioned a few symptoms, but now what are some of the symptoms that, as a parent, I should observe and know is something wrong? You've touched on some, but probably there's some that you'd want to add.
Okay.
Yeah.
So how I can approach this is we can look at it in terms of ages. So if you have a child who is, first of all is let's say less than 1 year old.
Okay.
And we have these things called milestones, such that by the time a child is this age, they're supposed to do this thing. So say for instance, we all know that at 6 months the child should be able to be sitting, at 1 year should be able to at least be trying to walk or walking with things, So if you notice that there's a delay in the child, so by 6 months, by 4 months, the child is not able to hold up the neck. You know how you hold babies and they're able to have the neck control. So if there's a delay, and then you're seeing some movements that you cannot explain, then the best thing is to seek medical advice. Then the other thing is, so if you have a delay in milestones, if you see any movements that you can't explain, because there's actually a severe epilepsy type that usually is in infants, and the child just looks like they used to be called salam attacks, where a child just does that.
Okay.
It looks very.
Doctor, you can come again.
Yes.
Yes.
I'll just. So they bend the head and do the arms. Unfortunately, it's a severe type of epilepsy.
Okay.
It's people don't really notice it. The mom will just say, "Oh, this happens," and they don't know what it is.
Okay.
And then it goes unnoticed. If it goes unnoticed, it becomes what we call refractory epilepsy, where you're trying to use more than 2 drugs to be able to control that sort of epilepsy. So I think it's important to know that there are those specific types, like that one where the child is bending the head and the neck, that you have to seek medical advice if you see that in your child.
And you're talking about an infant.
An infant, yes. So usually it occurs around 6 months of age. So if you see that, and of course it comes with the delay. Yeah. Then if you see that, you have to seek medical advice. Yes, and then there's the seizure types whereby we've mentioned before that occur in children. So we can start with the younger sort of age group, whereby the child may just drop. So there's a seizure type where child is just standing and just poop, they're down. Okay. You don't know what happened. There's no jerking. The child is on the floor. So this is also another seizure type. And as we mentioned, there's a movement of the head, of the hand. There's some who just, their head just moves. So they'll just do, it's like they're nodding the head. Like they can just do that. And some may do that, then fall. Oh, yes. Then we have the ones where, the staring episodes. Those ones are quite common, where when go up to Mezuba, then they're just staring. You're trying to get their attention, and then they look like, no, they've come back to reality. Yes. Then you have, of course, the one everybody knows where you're having
Yeah.
the jerking of the arms and the limbs.
Yeah.
But that one can also come where you have just one side is moving or one side is stiff. So that's also another different seizure type. I think one other one that probably people may miss is the children that we call psychiatric children. So there are some children whereby, like, they may have, at night they're just screaming, or they say they're seeing things, So the problem is some of these children will go and be told they are mentally ill. But they could be having a seizure type that is causing them just to see things, or to hear voices, or to just be, to be just jerking at night, things like those. Of course, there are other things that may cause other than seizures. But it's important to know the contribution of such behavior in children, so that we do not say this one is mentally ill and,
Okay.
So before the break, we talked about, all the different types of seizures.
Yeah.
I think it's important to know that because some of these happen at night,
Yeah.
you may have some things that you may see and then you wonder about.
Yeah.
So for instance, you may wake the child up at night in the morning, and then you notice that there's blood or cuts in the mouth. So I think this is an important thing. If you do see that, it's possible that something happened at night that caused all this blood and these cuts in the mouth. So that's an important thing to think about, and it's one of the questions anyway that we usually ask. The parents, does a child wake up with bruises, with cuts in the mouth in the morning? Another thing would be, you're waking up the child in the morning, and then you notice that the child is weak, and maybe takes a bit of time. Of course, some people are not morning people.
You take time before.
You take time before you wake up.
Yeah.
But then, and deep sleep that is unusual to the child is also what we call a red flag. So why is this child in such deep sleep? Especially for the ones who already are known to have epilepsy. Is it that they had a seizure at night and then they slept afterwards? Because you'll notice that for most of these seizures, the child will have the episode, and then after that will enter into a deep sleep. Yes, so usually the fact that it's an arousable, for us, it's an important thing.
Okay, yes, yeah, all right. So we can then go to the causes of epilepsy in children.
Yes. So there are very many causes of epilepsy. So one of them is infections. I think infections is one of the big ones. So if a child, say for instance, got meningitis or encephalitis, which is now a viral infection of the brain, then we say they are at a higher risk of getting epilepsy later in life. So as we said, epilepsy is when you have unprovoked seizures. So yes, they probably got this infection, but then it made the brain now produce this, electrical firing that is synchronous and excessive. So if a child has meningitis, we say that they have to be treated the correct way, get the treatment for that. So infections can range, we can classify them into various ways. So there's bacteria that gives you the meningitis. You can have viruses, which will give you, so a meningitis is infection of the covering of the brain. Yes, what we call the meninges. Yes. So, and it's a serious condition, it needs to be treated appropriately. Another infectious cause of epilepsy is encephalitis, which is now the brain itself is infected. And usually the commonest causes are viruses. So if you can have different viruses, you can have HIV. You can have in the small ones something called CMV, you can have HSV, even measles. Measles has to be treated, if a child has measles, can you just take them to a hospital, then they're treated the way they're supposed to be treated, because it also can lead to epilepsy. We also have parasites, so like malaria is so cerebral malaria is also a known cause of epilepsy. So once you treat, if it's insufficiently treated or it's a severe case of cerebral malaria, then you have a chance of actually getting cerebral malaria. Epilepsy later in life after having cerebral malaria. So infections that affect the brain or the covering of the brain are a big cause. Now, there's also genetic causes. I think those are the ones that everybody sort of thinks about. And then they will tell you, kwetu hakuna mtu akona convulsions, akona kifafa. So genetic is wide. So there is the inherited, whereby there's a family history of convulsions, whereby you will say, there's an aunt somewhere who had seizures, and you can trace it. Oh, okay, so this aunt gave birth, and then this, and then now this one has the epilepsy. But then genes, there's also whereby you can be the first in the family to have epilepsy. So that could be the only child, but then the cause is still genetic because it's their genes that probably had, something. Usually when genes are arranged, you can have a gene maybe being duplicated or being substituted. So any change in that gene, in your genes, can cause you to have epilepsy. And you could be the first one because that change in your genes could be just you. Yes.
So somebody should not just say,
yes,
kwetu kulikuwa nayo.
Yes.
So it can start and at any time of life?
Yes, it can start at any time of life. You can have, the teenagers just having, epilepsy. So especially, the jacking ones that we talked about before, the staring ones, those ones usually happen in adolescents. So you can have a child who was very fine, probably is number 1 in class, and just now gets the epilepsy. When they're in their childhood age, about 6 to 9 years, they probably get these staring episodes, and then there's you can have it at any part, and then genetics it's a big component, but not everybody gets epilepsy because of genetic causes. You can also have structural things. Something is in your brain, and it's the one that is pushing this, seizure. So if you have, a tumor, it can cause you to have seizures. Yes. If you have a cyst in your head, then that can cause, seizures. If you have, anything that affects the structure of your brain, then that can propagate having seizures. So those are the ones that we call the structural causes.
Okay.
Yes. Now we also have another group called metabolic causes. So this is where we have, so in the body we have things called enzymes. So enzymes help to break down carbohydrates, fats, proteins. So if you have a problem with your enzymes, then you're unable to break down your carbohydrates fine, you're unable to break down your proteins, then you can actually have a seizure. And
this time, the child we are talking about, it is when you are feeding a child, and now you feed them on the carbohydrates, for example, and they are having issues to break down.
Yes.
So that is what you're saying. It can also bring the seizures.
Yes, but I'm sure you're not doing it knowingly.
Yeah, so of course.
Yes.
Yeah.
So usually, so for these children, they're usually the young ones who are. How to know is that they don't grow well. They have delayed milestones. They're just small for their age. They don't. You're really trying to feed them, but they're just not growing, and then they're having these convulsions. So it could be that they're not able to metabolize the carbohydrates, the proteins, and in some cases the vitamins.
Okay.
And that's why they're having these convulsions, these epileptic seizures.
Yeah.
So I think the biggest thing is if you find a child who is not developing the way they should be, then the most important thing is to take them to hospital, find out what's actually happening.
Yes, because delays can become very costly.
Yes,
in the life of the child.
that is very true.
Okay.
Yes.
Okay.
Then you can also have immune causes. So immune causes is where your body is fighting against you. Your body is thinking that the cells or the proteins in your brain are foreign to you. So you produce antibodies to fight your own cells. Yes. So I think for these ones, if you go for consultation, and then you have epilepsy, then these are the things that we usually look out for. And we usually make sure to try and find what exactly is the cause of your epilepsy.
Yeah.
Is it because it's genetic? We can do genetic tests. Is it because that it's a structural, there's something growing in your brain? Is it because the child is unable to metabolize carbohydrates? So the causes are broad, yes, and but honestly, for most children, most causes of epilepsy are manageable. Yes.
Okay. So manageable even when they are discovered.
Yes.
Yeah, because sometimes they may go unnoticed, or even somebody may not know it is. Sometimes kids can behave in a way that you just think it is the normal way of a child, as you put it earlier, that it can be ikisirani tu ya mtoto. Ikisirani tu ya mtoto.
Yes.
While it is something actually that needs to be addressed.
Yes. Yes.
Okay.
That's very true.
Yeah.
So it's important to know, and then of course there are those children who are more susceptible to having epilepsy. So the children who have cerebral palsy, who have autism, children who had there are these convulsions that we don't usually put in the group of epilepsy. These children who convulse because they have fever. The fever is high. Yeah. Then the child convulses.
Yes.
So that's not epilepsy. Because it's a fever that is triggering it, and we said epilepsy is unprovoked, so it's not the fever that's driving it. But then those children who have fever and then they get convulsions have there's just a bit increased chance of them getting epilepsy later in life. So there are those groups of people who we know have a higher, they're more predisposed to actually having epilepsy. Yes.
Oh, okay.
Right. So in terms of the causes, they also guide the management.
Okay.
Based on what it is that has caused the epilepsy. So to know what is causing all these the different types of epilepsy, then we do several tests.
Okay.
So you may find that for a child who's probably having one-sided jerking, we may ask for an MRI of the brain.
Okay.
Yes. So an MRI of the brain will let us know, is there something on the opposite side, because the brain sort of processes the right side of the brain gives movement to your left hand, and your left hand is given movement by the right side.
Yeah.
So if you're having one-sided movements, then we will need an MRI of the brain to tell us whether there is something on the opposite side of the brain that is causing these seizures to occur. So for some children, if we think that the cause is genetic, maybe there's a family history of this in the family, then we will offer genetic tests and tell you, okay, do you want? We can do. If we think that this is the only child who has the epilepsy in the family, but we still think that it's a genetic cause, we can still offer genetic, tests for this particular child, just to find out what gene is it that is causing this child to have this convulsion. And some genes also are they're coupled together with some conditions. You can find epilepsy and autism having the same gene, so that gives you more information as a parent. Then in terms of if a child is having epilepsy, we can also ask for an EEG. So an EEG is an electroencephalogram. What it means is, just as we had said, epilepsy is when you're producing excessive electrical activity. Your cells are excessively firing, yes, and synchronously at the same time. So an EEG captures those waves, so it draws them out. Then we can be able to look at that tracing and be able to see, okay, so is what type of seizure is this child having? Yes, and it will also guide us in terms of the management, because as many as the types of seizures, the treatment is wide. So one child, we may say, this is the food you're supposed to take to be able to treat your seizure. Food is also treatment.
Yeah.
Yes. For another one, we'll say, don't use this drug, it will make the seizures worse. Use this other drug. So based on the tests, the EEG, then we can be able to guide ourselves into management.
Okay.
Yes.
I can see the test sequencing that you're doing.
Yes.
And I'm seeing that here, this session, it can be enough. So what I'm saying is that we do this be part one of what we have gone up to, so that you can have enough time to now really tell us those tests that need to be done.
Okay.
The additional ones that you may be having. So we'll have a part two.
Okay.
And this part two, we'll do it. We'll be able to do to share with our viewers. But we'll take this break.
Yes.
So next week we'll do part two. My viewer, next week we are going to do part two of this, because Daktari has not completed the steps that need to be taken as tests. Remember, we are still sharing with us. You're giving us feedback on how you as a community person, you as our viewer, how is epilepsy in children defined, and what do you call it in your community, so that even as we go along, we'll be able to reach out and help you even further. But for now, we'll stop it. You'll stop this episode today, and then we'll continue with part two. Thank you so much.